Polymyalgia Rheumatica, also known as PMR, is an inflammatory condition that affects the muscles and joints, primarily around the shoulders, neck, and hips. While the exact cause remains unknown, PMR is believed to result from immune system dysregulation, triggering inflammation in joints and surrounding soft tissues. It mainly affects individuals aged 50 years and above with symptoms that can significantly impact daily life and mobility. In the elderly population, it remains one of the most common causes of musculoskeletal pain and stiffness. In Nigeria and other African countries, awareness about PMR is limited, making timely diagnosis and treatment a challenge in many healthcare settings. Today, on your favorite health TV talk show, The Physicians, we'll be talking about polymyalgia rheumatica with our expert in the studio. Do stay tuned. We'll be right back. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. Today we are going to talk about another, important topic that is common but most times misdiagnosed, and that is polymyalgia rheumatica. My name is Dr. Memuna Yusuf Kadri, and of course, I'm never alone on this program. I have my amazing and beautiful dear sister and co-anchor, and she's no other person than...
My name is Dr. Martina Agbemi. Welcome to regular health TV talk show, The Physicians, where your health is our business.
And will always be our
business. Always remain our business. Don't mind Dr. Memuna, this big name that she just mentioned.
Polymyalgia rheumatica is common among individuals 50 years and above.
You will get there. That is all I can tell you. You'll get there. And imagine a patient coming to tell you, Dr. Memuna, I think I have polymyalgia.
In fact, I'll be so happy. I'm very happy when patients come with diagnosis. I said, give me the evidence. Most times they come with printed document. They have gone to read the website. I'll say, thank you very much, ma. Or thank you very much. You've done my work 50%. My dear, sit down. Let me not tell you how you arrived at this and what is available here in Nigeria. Yes. Especially when they come with treatment plan, that I know that now that I've never even verified, we've never done trials to even know whether among black populace. I'm always very happy when you come knowledgeable like that. It gives me the ginger because I know that we're on the same page. Yes. So, but this name, Sha,
the name is big.
Yes.
I can't even remember when I pressed. I made a diagnosis
of polymyalgia.
Most times you just say, well, you look at it, okay, arthritis. Yeah, because those are the most common things that you find around. But as usual, we always have this consultant that has a way of.
That's why I like
some very some topics.
I said earlier on that this our particular expert, he should even start talking about, common medical conditions, but that are highly misdiagnosed. So people will know that these things exist. Because most times when we don't have a name to it, we will start saying it's a spiritual attack. Mother-in-law has entered, village people and all that. So with him in the studio now, he talked about, he has been talking about very common but highly misdiagnosed medical conditions. So it's good he's right here in the studio with us. So we'll be right back after this time out. Do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today on the show with us is no other person than the amazing Dr. Dumebi Okafor. He's a medical director, Medical Hospital, and he is a consultant family physician. He will be deep diving into this very important topic, polymyalgia rheumatica. Dr. Okafor, you're welcome.
Thank you for having me.
Welcome.
Thank you very much.
Why are we talking about this big
Named.
polymyalgia rheumatica? Our audience wants to know.
Well, given my experience with patient suffering, the profoundness of the patient suffering, I would say the name matches the problem.
Wow.
I'll start
So
with that.
big name, so there's big problem.
Big problem. You know, polymyalgia because it affects several joints. Rheumatica because it's very similar to rheumatoid disorder in presentation, initial presentation. But again, we're talking about it because it's in our last episode when I had the pleasure of you guys, having me here. We talked about a list of conditions that are sort of nebulous and therefore easy to pin down, while polymyalgia rheumatica is low on that list. Because again, along with diagnostic criteria, there can be some things you actually see objectively. But those objective findings, by objective findings, I mean things you can test for and find, are not always present. And again, it needs a lot of a high index of clinical suspicion on part of the diagnostician, the clinician, to be able to separate this from, say, the person is making it up, or they begin to think about spiritual cause or relational cause and all that. These are definite clinical syndromes.
So what causes?
Well, you mentioned it in your introduction, I think, and that's true. Again, unknown, clearly.
Wow.
But because of the fact that there are, we say, mild to moderate synovitis, that's joint inflammation. Therefore, it follows that it has to do with a disorder in immune regulation. And so that is the current standing paradigm for explaining what it is. No clear locale yet have been. Immune disorders, for example, we always have locales in the DNA where we say this is where this thing is located. Nothing clearly, determined yet for this. But of course, you have joint inflammation as a distinct part of this disorder, and therefore that is the current theory.
So, what is the difference between this and rheumatoid arthritis? Because oftentimes when people complain about the joint aches, considering the areas that are affected, and Dr. Mimona talked about during the introduction, and what you also said, the joints affecting multiple joints. We know that when they come to complain, the first thing that comes to mind is arthritis, then rheumatoid arthritis. So what is the difference between rheumatoid arthritis and polymyalgia?
Yeah, thank you very much. I always said that clinical entities are like people you know. You see Dr. Mimona, you say this Dr. Mimona. You see Dr. Martin, say this because we know them well. The same way, doctors familiar with the nature of these entities should be able to tell because they are very different. Where we say the patient might complain of almost the same thing, but by the time you begin to actually interview that patient, you see, for example, that the joints affected are completely different. Polymyalgia is clustered around your pectoral and pelvic girdles. That's your shoulder and hips, limited to those ones. While of course, also rheumatoid arthritis, your small oligoarthritis in your small joints, your knee joints, your elbow joints, things are not affected by polymyalgia. And also, of course, in rheumatoid arthritis, you actually have things like rheumatoid factor and other immune complexes that are detectable in the blood to distinguish that entity from polymyalgia. Polymyalgia is always tenderness and pain. By tenderness, means you can actually push on trigger points and the person will shout along the shoulder, the neck, the hips, and then the thigh. Right? And so that completely distinguishes it from rheumatoid arthritis. Plus the fact, like I mentioned earlier, that rheumatoid arthritis is a clear autoimmune disorder, well located or well defined.
It sounds quite interesting.
Really interesting.
Because now we are saying polymyalgia rheumatica is common among people 50 years and above, and female, and it's just specific to from the shoulder to the hip. Why so?
Well, again, like I said, it's just the feature of the disease, which is not something. It's not something. Yes, and so what you just said is a very important distinction. Rheumatoid arthritis can have it in children. Juvenile rheumatoid arthritis, so it's in all ages. Whereas polymyalgia, we say the incidence is about 1% in people above 50. It starts to rise. So if you take 100 people who are above 50, one of them must have it. So that's a very big distinguishing factor. It's only in the elderly mostly, whereas rheumatoid arthritis can affect all ages, right? So this is the way it is, and apart from the distribution of its clinical features. Why? Who knows? Why is anything the way they are? This is medicine, this is nature.
Okay, so because you talked about being autoimmune, right?
No.
Rheumatoid.
Immune dysregulation. Yes, rheumatoid is not autoimmune. It's a definite enzyme complexes found, protein complexes generated by inherited DNA-located immune disorders, right? That attack the joints. You can't find the same things here, but of course we are, and the arthritis is not as severe as you would have in rheumatoid arthritis, where you actually have joint destruction over time. This is mainly, again, like fibromyalgia, like chronic fatigue syndrome, it's a pain disorder mainly.
So are there certain kind of food that, because now we are focused a lot on lifestyle modification, what we should do and how we should do things better, and how our gut health is our second brain.
Absolutely.
Because most of our hormones are generated as if your gut health is right. It's a big immune booster for you. Are there certain food that people should watch out for when it comes to PMR? They shouldn't eat or they should add to their meal?
So I think, first of all, that is the doing of the nutritionist, right? But if we say we have a disorder that's inflammatory in its baseline, then you want to avoid foods that can cause inflammation. Fatty foods. Foods that are rich in the wrong kind of omega acids, So you have 3, 6, and 9. If you have more of the 6 and the 9, you are going to have an inflammatory response to the meal you have eaten. So it is to work with the nutritionist and say, which of the meals I'm taking will aggravate inflammation? But of course, the second layer of that is weight control. Whenever you have these myofascial, musculoskeletal problems, it doesn't help to be overweight.
At all.
Right? So you also want to diet from the point of view of calorie restriction to reduce. And the third layer is that of micronutrient supplementation. Whatever our body is dealing with, especially when it comes to inflammation, there's a lot of tissue repair needed, necessary. So if you are not, which most of us are not, you are not sufficient in your daily allowance of, then you're going to have less to work with.
How many people even know about the daily allowance?
Nobody knows.
People are hungry. You want to fill hungry, up. Exactly.
And not only that you are hungry, you are eating the first that comes to.
Exactly.
So
let my tummy be filled up.
So even if it's Gary, Eba, 3 times a day, you are happy.
You are happy.
And that gives you nothing. So where you have a problem like this, and with most problems, it's important to think about your, supplementation with your minerals and vitamins, to give your body the ability
Think about your minerals supplementation. Very, very important, because
it's very general.
50 years and above, your quality of life is very key. You are still supposed to live. In fact, there was a place I read that said every human being can actually live up to 120 years. So why are we making it look as if, at 50, you are still young as far as we are concerned.
100%.
So things that you should do, at least your nutrition is very key. Now, Dr. Okafor, is this hereditary? So that let us now know how we can be telling our children that, look, there's one disease like this. It's possible, especially you are my daughter. I may have it. Is it hereditary, and could it be life-threatening?
Thank you very much. Yeah, the findings with Polymyalgia Rheumatica, like other diseases in that category, subcategory, is that you have things changing in some people, mutations in some people, where there was nothing before in the family line, and then they end up having this, nobody before them. But then the tendency for the children, the progeny to get it is still there. The bottom line is that we are thinking it's an immunological disorder, a disorder of the immune regulation, and therefore that has to be hereditary. Because those things are coded for by your genetics. Your immune system, like everything else, is coded for by the package you have in your DNA, packages you have. So if you now have, it's possible to not be that way before, but finally have changes that lead to that, there's an increased tendency to pass it on to those with you.
So life-threatening or not?
Not life-threatening.
Okay, so
just the consequences and the burden of the illness, yes.
Okay, so now this very challenging ill health, right? Yes, it's very challenging. I'm very frustrated.
Yeah, very debilitating. Yeah, no.
But
at the mud back, yeah.
That back, it has a lot of functions, right, for humans. And the waist, the hip region. First and foremost, is it commoner in the blacks or Caucasians, number one? And you have said a whole lot about it. And our people that are listening. Yeah. So how do we manage? Does it have a cure? Or will the person live with it all the days
of his life?
Existence?
Thank you very much. First of all, it's occurs in all races, all socioeconomic groups, and with a predisposition to certain the elderly people, like we said. In terms of, it's also important to mention again, it's important to mention the fact that its clinical manifestation is pain and tender points in the shoulder and the hip girdle. It's important because this again is the primary responsibility of the physician to help the person discern what's going on. So physicians, when an elderly person comes of pain, stiffness in the neck and the back, should take the time to examine, push on the pressure points and get the response. If it's serious pain, and they have to make the diagnosis before anything else. So it's actually a very simple diagnosis to make. It's just that they should be bearing it in mind so that they can actually quickly diagnose the patient and begin treatment protocols. Again, like the one we discussed in the last episode, they are non-pharmacological treatments, and they seem to be actually more important in this case than the pharmacological ones. So you have things, again, like dieting, like we said, right? You have things like exercising, physical activity, all right? Especially with a trained physiotherapist, stretches, TENS machine, the transcutaneous electric stimulation, yes, to help you reduce pain sensitivity points. And also, you now have pharmacological treatments. It's a pain disorder, it's an inflammatory disorder, so obviously, NSAIDs, other analgesics, and of course, corticosteroid injections into the trigger points would help to reduce the burden of pain. In terms of the psychological impact of it, as with the one we discussed last time, it's important to screen patients for mood problems resulting from this and treat that as well. And of course, you have mood medications that are also used for chronic pain. It's a good opportunity to use those to combine the benefit from them. So yes, there are medical treatments. To the last part of your question, no, it's expected to always be there. Like most chronic problems in medicine, you are managing and not curing. And so whatever helpful strategies and protocols that you find, you should maintain them. The lifestyle of activity helps you, and eating right, maintain it. If there are some medications barring chronic side effects from the meds that are helping you, maintain them. Work with the doctor closely to see that you gain, you sustain the gain that you have from this treatment so that your life returns back to normal. It's a struggle for quality of life restoration, not for disease elimination.
Okay, so I'm just wondering, because most times people actually think, because you're talking about the shoulders, right? And the pelvic area. So I'm just wondering if people will not even think that it's like a referred pain, when you keep having it around the shoulder, remember that with the spinal cord, okay, we think you have a pain here. You think it's from the cervical region and it's a referred pain. So what I want to ask is, when the pain comes, is it localized to only one side, or you have it
transferred? Yeah.
So
yes. For a patient, okay, who probably will always complain of having this pain of the head coming down as if there's something just coming down, what do you really think? Could it be linked? That's not talking about referred pain. Could it be linked to?
So I'm trying to pick up a lot of things from what you're asking. First of all, the confusion as to what you have should stop at your doctor's door. You as a patient, you don't know. One from there, you just know I have pain. The doctor should be able to discern. The moment you cross that threshold, it should be clear to the physician, because there's no confusion between referred pain and polymyalgia. Simple physical examination will show that you have tenderness, which is not there with the referred pain. Referred pain is by definition referred. The pain is not there. But this one, the place is painful. The trapezius muscle is tense, and along the trapezius muscle there will be tender points, so it's not confusing. And then the other part of what it brings to me is the fact that the doctor's responsibility now extends not just to recognizing that this is not a referred pain, but to separating them from the other things that are very similar to it. You mentioned something, you talked about headache. That brought to my mind a very, very important clinical syndrome that looks like the sister to polymyalgia. In fact, polymyalgia has two sisters. It has giant cell arteritis, which presents with headache, shoulder pain, jaw claudication.
Giant cell arteritis.
Giant cell arteritis. We should talk about that sometime. You know, so a doctor has to separate that from this. The other sister is fibromyalgia.
Exactly.
In which case, yes, closely linked. In which case you have, again, a lot of fatigue, and then you have pain in the shoulder as well. But in this case, the pain also involves the limbs. The elbow on the lateral side, the medial thigh, the hips, you know, trigger points. Fibromyalgia is distinguished again by the fact that it has a map of trigger points. And there are 18 of them, and there must be 11 of them positive out of that 18 for you to make the diagnosis. So the doctor has a responsibility to separate this. But at the moment the patient comes to the doctor, there should be no confusion as to whether, because the features of this pain, of these syndromes, are quite clear and well defined. We may not know what's causing them totally, but we know how they present.
So before we let you go, Dr. Okafor, I want you to speak to Nigerians on what they should do, because this is commoner, 50 years and above, what they should do, you know, before they won't turn 50. Are there certain things they should start doing now? And of course, if this comes on board, what they should start doing, like first aid. It's debilitating, it's manageable, it's beatable, but it's not curable, it's treatable. So speak to Nigerians, like those tips that they should take away from this program today.
The difficulty of that mandate you've given me is that this is not something. This is not something you can. There's not something you can do anything about.
Yes.
Per se, but
like advice.
My response to that would be the general one.
Okay.
Be kind to yourself.
Awesome.
Now the problem with that again is that in our environment it's hard to be kind to yourself. So it now becomes you know, a personal challenge. Yes. It now becomes a personal challenge to find that balance.
No, I think maybe give yourself grace.
Yes, give yourself. Very important to give yourself grace. Very important to rest as often as you can.
That people don't want to give themselves, be kind to themselves.
We know that people want to be kind. Those are their obstacles.
And that's what I take from give yourself grace.
Yes,
no.
Forgive yourself. Forgive yourself. Exactly. Give yourself. Yeah.
You might make mistakes. You might run into encounters. Take it easy on yourself. Let go. Forgive others.
Yeah.
Give peace a chance.
This is a beautiful way of us ending up this. Thank you so much.
You're very
welcome. You so much.
There's a lot to say on this.
For our viewers out there, you can hear our guest in the studio has just made, in fact, he rounded up this whole discussion from the big name to a big disease with big burden that doesn't have cure, but is treatable, manageable, and beatable. At the end, he said, forgive yourself. Give yourself grace. Be kind to yourself. Amidst all the chaos and challenges, if you learn to forgive, you learn what forgiveness is. If you learn to give yourself grace, you live in abundance, not necessarily from scarcity. And if you are kind to yourself, expressing self-love, self-compassion, you'll be able to heal because it's not curable, and you'll be able to, still thrive and flourish despite the challenges.
Exactly.
On that note, my name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
So, Dr. Okafor, I just want to say thank you for taking your time and coming on this program.
Yeah, pleasure.
Like I said, each time you come, it's always very interesting and just breaking down some very serious topics that are not very common in our environment. So really appreciate you. And again, I want to appeal. You've mentioned 2 topics that I think we want to invite you to come and take on. Talk about the giant cell arthritis and of course fibromyalgia. That will be the next 2 topics we'll be inviting you for. So our audience, I'm sure you guys will be happy to see you back and talk about that. We really appreciate you.
Thanks so much.
And we look forward to seeing you. You have heard it all from Dr. Memuna and from Dr. Okafor. Be kind to yourself. Be kind to yourself. What you know is better. The important thing is that you've known about this ill health. You've known about how to manage it. And people 50 and above, whenever they mention 50 and above, don't get worried. There are ways that you can actually live with it and you still age gracefully. Be kind to follow us on our social media platforms. My name is Dr. Martina Agbemi. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.